a show that tackles the big issues affecting the BVI and the rest of the Caribbean. Searches for answers to today's big questions and gives viewers a unique perspective on developing stories. Follow the big story with me, Kathy Richards, only on GTV. Cancer awareness sparks discussions in many angles, and Mrs. Globe BVI Dr. Arlene T. Penn is not slowing pace in channeling these discussions where they are most needed. Though it may come as a surprise to many, when dealing with cervical cancer, one cannot shy away from one topic: hysterectomy. Today on The Big Story, Convo in the Tropics, a candid discussion led by Dr. Arlene T. Penn with Dr. Kedrick Pickering.
When I was first diagnosed, I remember going to several doctors I went to. I had my initial gynecologist, and then I started to go to at least 1, 2, 3, 4, 5, because I didn't really want to believe the results. And the fifth doctor I went to, I went to 4 females and then a male. And then when I went to this male, I remember I was in the room, and you know, you would have the nurses there with you. You have to undress, and I heard this voice coming, and the voice said, "It doesn't make sense to undress because you need to go and get yourself treated, and you need to do it now. And if you don't do it now, it's only going to be a matter of time that it will kill you." And I sat in the chair, and I said, "Well, what kind of doctor they send me to?" You understand what I'm saying? I couldn't figure out what kind of doctor they sent me to. And he said something that blew my mind, because I didn't have a conversation with him. He said, "Do not worry about the man. He will not be here anyway when you come back from doing your treatment." In other words, he said, "You have children, you need to go and take care of yourself, and you need to do it now." Well, the seriousness on his face and his voice, I had no choice but to go back to my doctor to get a referral back to Dana-Farber, and here I am today, 18 years later, a cancer survivor. So I want to invite you, Dr. Pickering, let's have a conversation. So Dr. Pickering, the first question that I have for you would be this: what made you, as a male, get into to be a gynecologist? Why a gynecologist?
Good evening.
Good evening.
When I came back home, first in 1986, I worked for 2 years at the hospital before I went back to study. Actually, my first love was pediatrics. But studying the situation in the country at the time, I realized that not only that Dr. Smith needed a lot of help, but that Dr. Bruley was also wearing thin on herself. And it was more a practical decision at that point in time than anything. I could have done any aspect of medicine. It wasn't any like special love that I had for that particular era. Whatever I had done, I would have given it my all, that's all.
Okay, now that you've said that, it makes a lot of sense, because Dr. Bruley was my gynecologist, and she was the one who would have given me the first diagnosis, and she referred me to you. So for the first time, it's now making sense, because I didn't realize that there was a connection between you and her. But just out of curiosity, how many babies have you delivered? How much you would say? Because it's a number of them, right? Hundreds.
No, I don't know. I never checked.
You never check. But how do you feel though when you see the babies you would have delivered and then they become older? How do you feel?
Well, it's been an interesting journey. I mean, a lot of people that I deliver now are themselves the ones I delivered. So I'm into my second generation in terms of doing deliveries. So it's like somebody will show up. My mommy said I should come to you because you deliver me. And that's where I'm at on my journey.
Okay.
At this point in time. But the numbers, I never paid attention.
Okay, all right. So let's talk hysterectomy. When we say hysterectomy, what are we essentially really saying? Hysterectomy.
So a hysterectomy is basically the removal of the womb. Mm-hmm. That's HYS refers to the uterus. Ectomy in any medical terminology means removal of. So hysterectomy is removal of the uterus. And I'm sure you'll ask the question, but there are different names that are attached to the hysterectomy, the particular type that you're about to do. So, but I'll leave that for you to.
Okay, so what are some of the reasons you would see, or would you even say to a person that, hey, I think that the treatment for you would be a hysterectomy? Because there are a number of different realities. In my case, it was the cervical cancer, but I know that there are others.
The commonest reason in black people is uterine fibroids. It's like 1 in every 4 black women are likely to have an issue with fibroids. And before you ask the question, I'll answer it. We don't know what causes fibroids. We know it's more common in the back race. Every now and again, we have visiting doctors with us in the operating room, and when they see the size of some of the fibroids that we remove, they're completely flabbergasted, especially when they come from the United Kingdom, because there's a definite racial predilection to affecting black people more. So that's the commonest reason why, in our setting in the Caribbean, why women will need to have a hysterectomy. Of course, the reasons why you need a hysterectomy is not necessarily because you have a fibroid. Because I always tell my patients for sure that because you have a fibroid doesn't mean that you need surgery. Okay. It depends on the type of problems that you have that are contributing to your not being well, is what is the deciding factor. And it's not the size of the fibroid either that matters. It is what is causing the problem. So in the clinical setting, if I saw someone that had fibroids that were unknown to them, it was just discovered on a regular examination, I would automatically say, but you don't need to have surgery because you're not having any problems. And then I would add on to that and say that when you need to have surgery, you will know you need to have surgery, because when it becomes a factor in your everyday life, when it starts interfering with your daily living, then you will know that you need to have something corrective done to the issue. So it's not because you have a fibroid means you have to have surgery. And of course, the other reasons is that women have to have hysterectomy, as you have outlined, the issue pertaining to abnormalities of the cervix. That's probably the best way to put it, because it doesn't necessarily have to be cancer of the cervix for you to have a hysterectomy. You could be 35 years old, you've married, you have your family, and you show up with an abnormal pap smear, we will have a discussion with you with why and what are the specifics that you need to do with respect to having the treatment. And in a case like that, it may very well be that a hysterectomy is the best course of action in your clinical setting. Okay. A 35-year-old lady with an abnormal pap smear who's never had children is a different issue altogether. You have to look at what other modalities of treatment that might be available in that context. Okay. And then there's another class of patients that have hysterectomies because they have what is called uterovaginal prolapse. Not a very common issue in our setting, seem to be more common in the temperate climates. In the colder climates, doesn't seem to be a big problem, but it's a situation where the womb actually prolapses outside of the vagina. That's another indication to have a hysterectomy. And then some women just have chronic pelvic pain for various other reasons that are not as common. So those are the main issue. But the number one issue in our setting isn't cervical cancer, it's uterine fibroids.
Okay, well, in terms of the uterine fibroids, because I've heard persons say, well, I took them out, but they have returned. And is there a reason why it returns? And does that then mean that there's a hysterectomy would be needed after, if it returns?
So, to answer your question, you're speaking about a different operation. It's called a myomectomy, which is the removal of the uterine fibroid without removing the womb. That's a specific operation we do for women who still want to have children. Okay. So we'll take the fibroids out and leave the womb, and you can go on and have your family without any problems. The fibroids grow back because there are what I refer to as seedlings in the uterus that you can't necessarily see with the naked eye at the time when you're doing the surgery. And those will grow and grow over time. So somewhere 10, 15 years down the road, you're likely to need another operation. But from a practical point of view, by that time, you would have had your family and you're at the end of your childbearing years anyway, so it's a different issue altogether.
Okay, so is there, let's just talk about the different types of hysterectomies. I mean, I was exposed to 3 different ones, and it's such a tough decision for you and your doctor to make, because especially as a young person, it alters your life in just a significant way. So I want us to talk about that more, about the different types of hysterectomies that you would perform.
So if you can see this picture, this is a diagrammatic representation of what the female organs look like. This is the womb here. So the fallopian tubes. These are the ovaries. And for the males in the room, I always tell the males, the spouses, a man have 2 balls, a woman have 2 ovaries. The balls are external, but in the female case, they're internal. They pretty much perform the same function. A man produces testosterone, which is the male hormone. The female ovaries produce the estrogen and progesterone, which are predominantly the female hormones. And when you talk about hysterectomy, and this is something that you need to pay attention to, this is what we take out. And one of the commonest questions that we will have to answer is, so if I take out my womb, does that mean I'm going to go through menopause? That's a very common and standard question. And with respect to the question that you ask about hysterectomy, hysterectomy is the removal of the womb. It does not mean the removal of your ovaries. Removal of the ovaries is there's a different indication for that, and that has a different name, although everything can be done at the same time. So from a medical point of view, and so as not to confuse you, there's something called a total abdominal hysterectomy. There's something called a subtotal hysterectomy. And then there's something called a radical or extended abdominal hysterectomy. And to confuse you even more, there's something called a vaginal hysterectomy, which is the one we do when the uterus prolapses outside of the vagina. We actually do the operation through the vagina. You don't actually get a cut in the abdomen. That's called a vaginal hysterectomy. The difference between a total abdominal hysterectomy and a subtotal is when we cut right here and we leave the cervix behind. So we'll take this part out and leave that part there. And there's a very good reason for it. So if you have any problem related to the cervix, of course, you don't qualify for a subtotal hysterectomy. Subtotal hysterectomies are usually done in younger women. So if you're 34 years old, you're having major problems with fibroids, bleeding, you've had 3 children, you don't want any more children, we would recommend that you do a subtotal hysterectomy, because in your younger years, and pay careful attention to this, in your younger years, the cervix plays a major role in the quality of the orgasm that a woman experiences. And so we would advise you that it's probably better to leave the cervix in so as not to interfere with the quality of your sex life post-hysterectomy. But of course, if you had something wrong with your cervix, you won't qualify for that. We'll just have to take the cervix out. But that's a discussion that we will have with the individual patient under the conditions with respect to the individual circumstances. But most of the patients will have total abdominal hysterectomy, which is the removal of the womb and the cervix as a total entity.
Okay, so does the hysterectomy mean no more pap test?
No, it doesn't. In most cases, it does. But the specific answer is it depends on the indication why you had the hysterectomy in the first place. So if you had a hysterectomy, in medical jargon, what we will say, if you had a hysterectomy for a non-benign condition, benign means non-malignant, that's one thing, as opposed to if you had a hysterectomy for an underlying malignant condition, as you alluded to in your situation. So as you alluded to in your situation, somebody like you would need to be followed up with pap smears. But if you had a hysterectomy for fibroids, you do not need to have pap smears after you've had the hysterectomy. But it is a discussion that is individualized between you and your doctor, not to be confused with all the medical jargon. That is one of the most critical things. It has to be a discussion between you and your doctor so that you know exactly what pertains to you, not what pertains to somebody else. Not what your cousins say or your friends say or you read on the internet. It is what matters to you in your individual situation. And that discussion must be had with your doctor.
Dr. Pickering, here's this. Someone asked me this question. When you've done the hysterectomy, and obviously you're not seeing your period anymore, you're not menstruating anymore. The question is, all of that blood that you would usually have had when you had your womb, where is all of that blood going now? Because sometimes you feel the symptoms, because I do get the symptoms still. Your face begins to break out, you become bloated. So the question is, where's all of that extra blood going? Because it's not coming out anywhere.
Just look at this diagram and I'll explain to you. Very simple. When you're having your menstruation, your period, the blood comes from here, that lining of the womb. the inner lining of the womb, it's called the endometrium. That's where the bleeding comes from. When you take the womb out, that's gone. So there's nowhere for the blood to come from because that's where the blood originates. It's that simple.
That simple.
That simple. I know there's this question everybody wants to ask.
Okay.
You know, and in every patient that I have the discussion with, I will introduce the question if the question is not asked. It's the commonest question that surrounds hysterectomy. How does it affect my sex life? It is the question, it is the elephant in the room. You know, and when I have these discussions and I sit patiently and I say, have I answered all your questions? I say, and they might say, pretty much. I say, no, you didn't ask the most important question. Because if you don't ask it, your spouse is going to ask it. And it doesn't matter what your friends say or what you read, okay? How does it affect my sex life? That's the most important question that any woman who is undergoing a hysterectomy wants to know. Because contrary to what you may or may not have heard, your sex life peaks in your mid-40s. A woman's sex life is at her best between 45 and 55. That's when a woman is at her sexual best. And if you're taking out your womb at 45, you have to be interested in knowing how it's going to affect your sex life. I mean, it's practical, you know, and so it's, and you look at my face and you see I'm serious. There's no joking matter because it's a serious thing that everybody's going to ask. Sex is extremely important, especially in your middle years of life. Sex is not, when you're in your middle years of life, you're not having sex to have fun. It is part and parcel of your normal, healthy, everyday living. It's that simple. Sex is a vegetative function. It's just like going to the toilet. It's just like eating food. There's nothing, you know, we have a taboo about it. But, you know, you get hungry, you have to eat. You need to use the toilet, you have to go to the toilet. And similarly, your sex drive is something innate. You try as much as you want, you can't make yourself feel sexy. Try as much as you want. It's a natural phenomenon. It happens and we respond to it. And the quality of your life depends on the quality of intimacy that you share. It's that simple. And as you get older, intimacy is even more important as your life gets, it takes on a different form. You have to understand that. So it's a very fundamental question. And I tell all of my patients, your best sex is ahead of you. And I have not had one person ever come back to tell me that their sex life was worse after the operation. Is a very simple reason why it's that. Because the very reason why you need a hysterectomy in the first place has interfered with your personal life. So if you're bleeding all the time, every month is heavy set of bleeding, all this amount of pain, all this amount of this and that, sex is the last thing on your mind. And it affects your interpersonal relationship. When you remove that womb and you no longer have those issues to contend with, no period, no pain, none of that stuff, it frees your mind to a level that you can't begin to imagine. And I just smile every time somebody comes back and I say to them, but you're looking so fresh. Doctor, everybody's telling me the same thing. But there's a very good reason for that also. Okay? You see, the things we take for granted in life, there's a very good reason for that too. The stress that is associated with these menstrual issues and these bleeding problems and this, all of that and all of that, when you have removed that, your whole body is going to change because stress causes your body to produce toxic hormones, bad hormones that destroy. You see somebody who has a lot of stress and see their face look crumpled and old, and see somebody who's living on top of the world and you could just see a different sort of, because when you're enjoying life, your body produces pleasurable hormones. They're called endorphins. The reason why you enjoy sex is because your body produces pleasurable hormones. Ain't nothing unique to you. You know, you ain't no better sex than anybody else because your physiology is such you produce pleasurable hormones and your body responds to it. So that is why I can say with all the confidence in the world that the best sex is ahead of you, because the impediment that you're facing before the surgery will be removed and it allows you to then have a much freer, enjoyable life. This is another issue that creates confusion. See the diagram, okay? As I was pointing out to you. That's your womb, right? ovaries, your fallopian tubes. Here's the reason. Your ovaries produces the hormones. The hormones are responsible for you to feel like a woman, you look like a woman. That is what determines your mood swings, your this and that and your other. When you go through menopause, menopause is the cessation of the functioning of your ovaries. So you stop producing hormones. So all of the changes that go through your body undergo has to do with the fact that your body stopped producing estrogens. So when some people have hysterectomy, we take out all of that. So if you're 45 and for whatever reason we have to take out all of this, and by the way, the name of that operation, so it will be called a total abdominal hysterectomy and a bilateral salpingo-oophorectomy. That's the medical terminology, when we take out both your ovaries and your tube. If you do that before you have undergone menopause, you're going to go through something that is called surgical menopause, which is meaning menopause is going to come on more suddenly than it would have come on in the natural stage. And that is what causes a lot of the metabolic and emotional changes that a woman undergo. Got it? Got it. So menopause is the cessation of the functioning of the ovaries, and the ovaries produces two main hormones, estrogen and progesterone. Estrogen is the dominant one. Estrogen is the one when you do not produce it, it causes all kind of problems that are, the medical terminology is vasomotor problems. It affects blood vessels throughout your entire body, and that is what causes the hot flashes. But the number one thing that tells a woman she's going through her menopause is the cessation of your menstrual period. You've gone a year without a period, you're into the menopause. But just let's be very clear about something. Menopause is just one aspect of that whole change of life, what we now refer to as the transition years. It's not a simple topic to discuss and just understand, because it's a whole transition that you go through from one stage of your life to the next, and it takes time. It can go over a period of years. That's a different issue altogether.
Dr. Prickman, I have a question for you in terms of, a while ago, the NHI said that a woman can only, you can only have your pap smear for, I think it's every three years. And I just want you to just explain that dynamic, because I think a number of people became frantic when that was said, because, you know, some persons, we want to have the pap smears every year, but now it's every 3 years.
It's confusing because there are two competing narratives, two different issues. NHI will only pay for your pap smear if it is done under the guidelines that they issue. That has nothing to do with the medical situation that an individual person finds themselves in. And not to be confused, it is an issue between you and your doctor, because if you have an abnormal pap smear, your doctor has to follow you up, and you need to have your pap smears done regularly. The guidelines from the American Colposcopy and Cervical Pathology Association is that if a woman has had 3 consecutive normal pap smears, she doesn't need to do one under those conditions for every 2 to 3 years at the discretion of your physician. The situation here is what NHI has decided they will pay for. That has nothing to do with the individual situation that a woman finds herself in, and it must be between you and your physician. I can't overemphasize that, because if you decide, NHI say that you shouldn't have a pap smear every 3 years, and 3 years down the road you have an abnormal pap smear, it isn't NHI fault. So it's between you and your doctor. I will say to you, look, your pap smears have been normal for the last 3 years, we don't need to do it for the next 2 years, something like that.
So if a woman does not have a particular medical condition that requires her to have a hysterectomy, I'm linking this back to some of the benefits you mentioned. If a woman chooses, for the purpose of enjoying some of the benefits you mentioned, to have a hysterectomy, is that something that would be considered okay?
No.
Tell me more, please.
No, because the first principle of surgery is first do no harm. And none of us who have been trained, the ethical guidelines, you couldn't stand up under any conditions with that, because there's no medical indications for doing the procedure. So the answer is no.
In regards to removal of the uterus, Dr. Pickering, I think you need to clear that myth up where most men, especially saying what happened to the hole. Yes, you need to clear that myth up first tonight. Thanks.
You know, it's an interesting question, right? Yes. Because most of the times when we do a hysterectomy, the vagina actually gets tighter. Here's why. If you look at this diagram here, see, this is the vagina. So you'll be entering from down here. What is referred to as the posterior fornix of the vagina is the deepest part of the vagina, and it's actually the biggest, not the entrance. The deeper part that surrounds the cervix. So when we do a hysterectomy, we take this off, we actually tightening up this at the top there. And in a lot of cases that, you know, creates even more enjoyment for the men. So it's another plus for women who have an hysterectomy. So it wasn't being facetious when I said that when I tell the patients that your best sex is ahead of you, that it is so. Because the positives, just remember that once somebody needs a hysterectomy, they have a medical problem that has been affecting them for quite a while. And if you have been having irregular bleeding, heavy bleeding, painful periods for, you know, a couple of years before you finally decide to go to the doctor, you're not having sex during that time, and if you're having any sex, it's not good sex. Once that impediment, because 50% of our intimate life starts in the mind, and that inhibitory factor has been removed, it allows you a freedom that you never had. So it leads you into a different world.
And we also have to bear in mind that just removing it just like that, you know, there's no opportunity again to have children because you can't put it back, you know, put it back in. So Dr. Pickering, do you want to wrap up this section with any last words that you have to say?
Just to say that the issues that lead to hysterectomy are invariably issues that are creating problems in your personal life. And it's a discussion that has to be had with your doctor, because you don't just have surgery for having surgery's sake. What I've tried to do is give you the positive side of it, so that you can know that if you have to undergo a hysterectomy, your life is not over. And in fact, you may be, as I usually tell my patients, go home and tell your husband that you have a brand new girl now. That's the upside.
Okay, thank you so much, Dr. Pickering.